COVID-19 has a vast range of circumstances depending on the person that's suffering the infection. And we know that from the much higher risk we see for elderly people, for people with certain risk factors like heart and lung disease, other chronic conditions. And not all chronic conditions can be addressed, but there are changeable chronic conditions that we'll talk about to reduce people's risk, not only for COVID-19, but for the chronic pandemic that we have of chronic disease in the United States, namely heart disease, lung disease, chronic kidney disease, liver disease, and so on. And so this is advice and guidance that you can give to people who may be at higher risk, to say, you can do all the things necessary to prevent your exposure to the infection, and that's fantastic, that's necessary. But also during the pandemic and in the hopeful aftermath, this will also help you live a longer and healthier life, regardless of whether we're still battling COVID at that point. So next slide, please. So social and biological risk both matter when it comes to COVID. The social risk has to do with housing situations, a lot of occupations that are frontline in different ways and put people at risk of exposure to COVID. But also, a lot of those same populations occupy occupational roles that put them at higher risk. Again, frontline workers, because they're in trucking or in public service or in food service, school teaching, etc. And it's hard to get a person, right, to not do their livelihood. So we want to make sure that we're doing everything possible that we have control over in partnerships with the patient to reduce their risk. And unfortunately, people in lower socioeconomic backgrounds who often are more likely to be in frontline occupations also have more chronic disease risk factors. And so we'll talk about some of that in the next few minutes. Next, please. This is data from the CDC on the death rates by race and ethnicity. I think we've seen a lot of these kinds of tabulations over the years of the pandemic. And again, it just documents that race and ethnicity is closely associated with risk for COVID-19. Next, please. So these are some of the social circumstances that increase the risk. Again, frontline workers, transport-related work, having to go to and from your job on public transportation, living in a crowded household, living in a multi-generational household that's more likely to, therefore, to have people with older age and chronic diseases, some of them that may be well controlled, some of them that may not be well controlled. And often shared kitchen circumstances. So there may be multiple generations eating meals together in very close proximity, sharing food preparation utensils and so on. And this comes out of a multi-country study that I worked on with some colleagues in the UK. And these were as true in the United States as it was in the United Kingdom, the higher risk for COVID in those circumstances. Next, please. Again, this is not anywhere near like a complete list of the COVID-19 risk for people with chronic conditions, but these are many of the most common afflictions in our community. So diabetes, people with smokers, chronic lung disease from occupational or from smoking, a history of cancer, recent chemotherapy, high blood pressure, and mental illness. And again, these are all conditions for which elevated risk of illness and death from COVID has been documented. Next, please. So again, just to always cover the fundamentals, the vaccine is especially important for those groups. The initial vaccine series with 1 or 2 shots, depending on the vaccine that they're using. As we were just beginning to talk about the boosters are important with the new variants. There's a new bivalent booster that covers the very contagious Omicron variants that covered much of the planet in the past seasons. People over the age of 50 can now get a second booster, a fourth shot, 4 months after their last vaccine dose. And particularly important if they're high-risk individuals, so 65 and older, or 50 and older with medical conditions, chronic diseases that increase their risk for severe disease from COVID-19. And these are available now. And so we need to get the messaging out that to be considered up to date, people should have that last booster that covers the Omicron variant. Next, please. So these are just some data showing the effect of obesity, diabetes, high blood pressure as risk factors for severe outcomes. This was a study from a very large study from France, looking at people hospitalized and at risk for severe outcomes. Ending up on a ventilator was quite common, 10%. In-hospital deaths was all too common, almost 15% for groups. The risk of obesity was almost twice for being put on a ventilator. For diabetes, about almost 40% higher, and for high blood pressure, 70% higher. So, and the risk for death about 20% higher for those risk factors. So this underscores the consequences, which if we know about ahead of time, we can do the things necessary to warn people, to take extra COVID precautions if those things are true, but also to begin hopefully to address those circumstances in their own life to lower their risk if possible. Next, please. So I'm just going to cover a few of those, and these aren't obviously COVID-specific things. These are things that we do every day in primary care to help people reduce their risk of, again, our prevailing long-time chronic conditions like chronic lung disease, heart attacks, and so on. So if you come across someone who's a smoker, what we do is a 5 A's strategy in primary care as a way to remember it briefly. So ask, do you smoke? If someone says yes, then you can advise them that their health would be improved if they didn't. I mean, the nice thing about smoking is there's no need for consideration about whether it's a good or a bad idea. It's a bad idea. The trick is to move from bad idea to a successful cessation strategy. So then the third A is assess what the person has tried in the past, if they're interested in smoking at the moment that you're talking to them. And then if they are, to assist them in a quit attempt. So again, depending on their life circumstances, their budget, their previous history of quitting attempts, you can pick a suitable strategy to help them. That might be anywhere from cold turkey to cutting back to recommending that they see a physician for pharmacological agents, for doing things that they can do on their own, like nicotine gum and so on. And then arranging follow-up to make sure that you circle back, because as we all know, quitting tobacco is very difficult, very challenging. There are a lot of relapses, and instructing people not to give up hope. A lot of people quit on their 5th attempt or their 8th attempt or their 20th attempt. And so as long as you're in it, there's a potential light at the end of the tunnel. Dietary strategies for weight loss, again, problematic for many people in our community, putting them at risk for diabetes and other obesity-associated problems. Again, many successes and failures, and often in sequences, but people stick with it. There is hope, and we'll go through some ideas for that. Participate in an appropriate tailored physical activity program to improve their cardiovascular health. If people have risk factors, this should be done in consultation with a healthcare team to make sure it's appropriate for their current health status and their future risks, perhaps with physical activity or other interventions. If people have diabetes, to optimize diabetes control with diet and medications. Often this will involve close work with the healthcare team, but as we know from our work in our own clinic downtown, community health workers can have substantial influence on making sure that people are doing the healthy eating and active living activities that we in the healthcare recommend, but aren't in their homes and neighborhoods to help them promote. And then, because of the social risk factors, addressing those to the extent possible, so screening for housing problems, potential pending evictions, food security, utilities that might be subject to shut off, transportation means by referring to appropriate social services if that's possible. These are things that more and more we're trying to screen for in healthcare settings, and challenging ourselves to make close connections with social services to accomplish that. But you who are in their homes and neighborhoods, see it firsthand and can make the intervention yourselves in terms of the recommendation to seek help. Next, please. So again, some things that you don't need to be a nutritionist to make some simple changes in people's diet. Eat whole foods, not processed. So eat chicken breast, not chicken nuggets. There's a vast gap. They're both, in the case of the nuggets, distantly related to the bird, but with a lot of additives and things that take away the healthful qualities and introduce a lot of unhealthful qualities of their own. If it's okay with the patient's healthcare clinical team, to get 30 minutes a day, again, if you live in a safe neighborhood, going down your front steps or out the front door of your apartment and walking for 30 minutes a day is free. If you have a buddy, it's even fun and has substantial health benefits. If the person is obese, again, often they may need some help from a nutritionist to put them on a healthful plan. But the aim is to lose weight gradually, 1 to 2 pounds per week. There are a lot of crash diets out there on the internet and different settings. They have very low long-term success rates, and people should be discouraged from doing those things, which can also be unsafe depending on the diet and how far off the straight line of good nutrition it strays. And again, even the word diet can be problematic, and sometimes it's better to stay away from it. So helping people think in terms of a long-term plan to eat the right foods in the right portions doesn't sound maybe as scary as a diet, and helps people think about the simple rules that help them kind of stay on a healthful eating routine. Next, please. Okay, that's a few quick points on health promotion in the home or in the community setting, and you can move on.